A lot of people wonder what causes facial paralysis. And it's pretty confusing because facial paralysis is basically the end finding of a lot of different conditions. So the way that I simplify it for myself is I basically think about causes of facial paralysis in 5 categories. There's infectious. And among the infectious etiologies, you have basically viral, like viral reactivation, let's say herpes simplex, that's a Bell's palsy, or herpes zoster, which is Ramsay-Hunt syndrome, or bacterial, things like Lyme disease or routine ear infection flora. So infectious is probably the most common. Next, congenital facial paralysis, people who are born where their nerve or some of the facial muscles are just congenitally absent. The third bucket is trauma. And trauma can lead to facial paralysis either in a blunt trauma situation where somebody receives a blow to the head and the ear bone actually cracks right where the facial nerve runs through, creating facial paralysis. Or there's penetrating trauma, things like a gunshot wound, a knife wound, a glass wound into the face that physically lacerates the facial nerve. The fourth, and also a very common cause of facial paralysis, is tumors. And when we think of tumors, you can have a tumor anywhere from the brain or the brainstem, or the facial nerve itself, anywhere along the course, or you can get a tumor in the parotid gland. And any one of those locations, a tumor in any one of those locations can cause facial paralysis. And the final category is iatrogenic, or doctor-caused. Sometimes we have to have surgery in the area that's close to the facial nerve, and that can cause either intentional or inadvertent transection or sacrifice of the facial nerve. So if you can think of those 5 categories, you pretty much have most things covered.